In our last video, we were talking about the history of the American healthcare system. And in this video, we're going to talk a little more about the Affordable Care Act, or Obamacare, which was passed in 2010 to address the number of uninsured Americans and to try and expand healthcare in the United States. President Obama had run on reforming healthcare. And that makes sense, as nearly a fifth of our economy is involved in healthcare. Now, despite claims by the right, this wasn't rammed through with no hearings. It passed in 2010, even though Obama took office in 2009. There were hearings, bipartisan negotiations, independent evaluation, and it was passed, and it was based, as we mentioned, on Mitt Romney's plan in Massachusetts. It passed on party lines by reconciliation and only after Republicans refused to negotiate at all. So what did the Affordable Care Act cover? It had an essential benefits package. You can see here. Many things are included. But one of the sticking points for people was mandatory birth control coverage, which makes sense, considering how many people have unintended pregnancies. And the idea is, if you want fewer abortions, you should empower women to be in control of their own reproduction and the timetable when they have children. One of the most important things it did was it abolished pre-existing condition provisions in healthcare plans. So no longer should you not be able to get health insurance because you had a health issue in the past. It used to be if you let your insurance coverage lapse, if you had insurance or you never had insurance, you couldn't get new health insurance to cover the healthcare issues that you had previously. And this included all sorts of things that are really important, like coverage for HIV, Alzheimer's, alcoholism, diabetes, drug addiction, heart disease, all of these things. By the way, pregnancy can actually count as a pre-existing condition, which is sort of interesting. And another thing it did was it prohibited annual spending caps. This is huge. If we think about this, if you have a child who is born premature, you could spend hundreds of thousands of dollars in that first several months of life. And that might be a spending cap. You could never spend any more with your insurance program, with your policy on that child, unless you switch to another policy. So getting rid of those lifetime spending caps as well as the yearly ones. And it also, really importantly for you in particular, it allowed you to have dependents stay on your insurance until 26. When I graduated college, I was 21, and I remember that there was this very short window I had to get a job because I was going to lose my insurance soon after that. How did the Affordable Care Act work to cover this, or how does it? One thing it did was it set up exchanges. Because the U.S. healthcare system relies so heavily on employers, there are many people who are not eligible for Medicaid or Medicare who prior to the ACA didn't have access to affordable healthcare because they didn't have employers who could pay for it. Self-employed, contractors, those who work for companies that don't offer health insurance. So that's any company with less than 50 employees doesn't have to pay for insurance. And those who are employed part-time. So Obamacare sets up these exchanges where people could come in and different states had the ability to offer different kinds of plans. There were 4 different types of plans, from the bronze base model all the way up to the gold and platinum models that had higher benefits. If you make up to 4 times the federal poverty level, you're also eligible for subsidies on the bronze and silver plans. But so most people opted for those silver plans, the ones that had moderate premiums and moderate cost sharing. There's also a catastrophic plan, which had very high deductibles, but it was only available to those under 30 and select groups. Though these plans made healthcare affordable for many Americans who had previously been unable to obtain coverage or couldn't afford the coverage that they could get, they were more expensive than the bare bones plans that people had used in the past. And as a result, there was a lot of frustration from people who felt that their policies were going up and they didn't necessarily want the added benefits. Because those plans that they had originally, they didn't cover the essential benefits. And, so if you ended up with some healthcare issues, they weren't going to be covered. Another thing that Obamacare did was to expand Medicaid. And what this did was it attempted to expand coverage by expanding Medicaid to people at or below 138% of the poverty line, which was in 2017 about $28,000. This was supposed to be national. But in 2012, the U.S. Supreme Court ruled that Obamacare, that the Obama administration couldn't compel states to expand Medicaid. And so it therefore became optional. And the result was that 19 states chose not to expand their programs. And what happens if you look at this diagram here, that a lot of adults fell into this coverage gap space where they have incomes above the Medicaid eligibility limit, but below the lower limits for marketplace premium credits. Another mechanism here was that there was the individual mandate. And this was one of the most controversial parts of the Affordable Care Act. It said everyone has to have health insurance, and that if you don't have it, then there's a penalty. And the idea was to coerce people, especially younger and healthier people, into the insurance market. Because insurance, in the insurance system, what happens is that the healthy subsidize the sick. That's how insurance works. Lots of healthy people pay in, and those premiums go and cover the people who are sick. The reason you want this mandate is what's called the free rider phenomenon, and you're combating that. In economics, the free rider problem is a market failure that occurs when people take advantage of being able to use a common resource or a collective good without paying for it. So the case with citizens of a country utilizing public goods without paying their fair share in taxes, for instance. So the problem here would be the healthy who would then go and join Obamacare, join the ACA at the point they got sick without having paid into it all along. So why do you want this? Because if you don't have it, essentially what happens is that we all end up paying for it anyway. So if you ever look at a hospital bill, it's sort of this crazy thing where you can see that you're getting huge charges. So in this case here, somebody goes to the hospital. This is a real bill, and the cost is $700 over $700,000. And then the insurance pays about $75,000. And then there is an adjustment of $635,000. And the patient is left paying $1,200 or so. Okay, so that's what happens when you have insurance. Where is all that money going? Why are these prices so high? Well, it's to cover the people who don't have insurance. So we're actually all paying already. It's just in different ways. So that you're funding this because the hospitals have to recoup the money that they spend on patients who don't have insurance. Incidentally, the only people who end up actually stuck with that bill, paying that full amount or being asked to, are the uninsured. And so you get this bill, there's no possible way you could pay it, but no one pays it. The insurance companies do. But it has come this way basically for hospitals to make up the difference. One of the things that we can look is Obamacare was incredibly effective at reducing the number of uninsured. So that you go from, in 2010, almost 18% of the population being uninsured, to by 2016, just right around 10%. And that's hugely important. But when we have to look at the differences between states, because as I mentioned, not all states, particularly Republican states, expanded Medicaid. And so Republican states that didn't see the drop in the same way that we saw in other states. So there were these premium increases that went along with Obamacare, and that did upset a lot of people and led to a lot of the anger at the program. But what wasn't talked about that was that there were these subsidies available as well. And so that if your premium went up, you were eligible to get many of these subsidies as well. Now, President Trump came in and he really weakened the Affordable Care Act. And what we've seen is that there have been more people, the rates of uninsurance have been rising. So we see that number creeping up from 27.3 million uninsured to 29.6 million uninsured in 2019. Again, these are pre-pandemic numbers. And by the way, while that was happening, insurance companies, actually their profit went up as well. In the next video, we'll be talking about trends in healthcare spending and how we compare to other countries.